Hello guys. So now we shall be discussing regarding the fourth ventricle. Okay. So we shall see what are the borders of the fourth ventricle from the lateral aspect. So the topic of discussion would be the fourth ventricle borders. So if you look at the fourth ventricle over here, right? So all of you know that this part over here will cover up your midbrain. So this part is your midbrain. Okay. Now just beneath the midbrain, the next important structure you have got over here is your pons. And after that you have got another important structure, and this is your medulla oblongata. So this is your medulla oblongata continuing your spinal cord. All of you know that this is the place where you have got your cerebellum. So this is your cerebellum all over the place. Now, for example, let us say this entire part is your midbrain. Okay. Next you have got your pons, and next you have got your medulla oblongata. Now there is a small duct that is present exactly in the center like this. Okay, so this duct which is exactly present in the center, this one is called as cerebral aqueduct. Okay, so this particular duct over here is called as your cerebral aqueduct. Okay, now after the cerebral aqueduct, there is another important duct all the way like this. Okay, so this duct which you can see all the way, that is going down, right? So this particular duct like this, which is all the way going down, so this has got another name. This is called as your central canal. Now if you can see here, how does this CSF flow? CSF will first enter into your cerebral aqueduct like this. From the cerebral aqueduct, and this entire part is your fourth ventricle, the CSF will flow into the fourth ventricle, and from there the CSF will enter into the central canal. Okay, so this one over here is called as your cerebral aqueduct, or the other name given as aqueduct of Sylvius. So this is called as your cerebral aqueduct. Okay, and after that this one over here is called as your central canal. And what is this one called as? This is called as your fourth ventricle. This part over here is called as your fourth ventricle, right? Now if I ask you about the fourth ventricle has got a roof, it has got a floor. Let us see the roof. You see, this is called as the roof of the fourth ventricle. So if I have to write it down, how is the roof of the fourth ventricle, or what is the roof of the fourth ventricle covered with? What you have to tell, the roof of the fourth ventricle is covered with, you see this notch over here, this is called as anterior cerebellar notch. Anterior cerebellar notch. So the roof is covered with the anterior cerebellar notch. Okay. Now after the roof, the next important part we have got over here is the floor. The floor of the ventricle. Okay. So the floor of the ventricle, with what it is covered by? The floor is covered by this important thing which you can see. You see this? The floor is covered by the pons above. You see, all this part is a pons, right? And below here you have got what? Below here you have got your medulla oblongata, right? And by the way, let me write it down. So this one over here is your midbrain. This one over here is your pons, and down to the pons you have got medulla oblongata. So now you tell me, the floor is made up of two important parts. The upper part is the pons and the lower part is the medulla oblongata. Now exactly speaking, this entire part is the anterior side, and on the back, cerebellum is on the back. So this is a posterior side. Now tell me, which part of the pons is forming the floor? The anterior part of the pons is forming the floor, or the posterior part? Obviously the posterior part, or the posterior surface of the pons and posterior surface of the midbrain. So not midbrain, posterior surface of the medulla oblongata. So these two structures together form the floor of the fourth ventricle. So floor is formed by two important structures. The first is posterior surface of the pons, and the second important thing is posterior surface of the medulla oblongata. Posterior surface of the pons and posterior surface of the medulla oblongata. So these are the two structures which form the floor of what? The floor of this area, fourth ventricle, right? And now let us see what are the cranial nerves that are basically coming out from here. Okay, so let us say that this part over here is your midbrain. This part over here is midbrain, and after the midbrain, this part whatever you have got over here is your pons. Okay, now just beneath the pons, so this part over here is your medulla oblongata. Now within this medulla oblongata, here this is the thing that is located. This is called as your median sulcus. Okay, so this is your pons. This part over here is called as your pons. Okay, now if you very carefully look here, there are two important cranial nerves, right? I have already discussed this thing. So there are two cranial nerves on either side that is coming out of the midbrain like this. So these two cranial nerves over here, these two are called as oculomotor nerve. What is oculomotor nerve? Oculomotor nerve is a third pair of cranial nerve. Okay. Now after that, from the pons, what cranial nerves are coming out? From the pons, you have got one cranial nerve that is coming out like this, right? So this is called as 5 sensory, that is trigeminal sensory nerve. And after that, you have got another cranial nerve also that is little more medially located, right? And that is coming out like this. So this one over here is called as your fifth motor. So you have got two cranial nerves, one is called as 5 sensory, another one is called as 5 motor. Fifth sensory as well as fifth motor cranial nerve. Next, between the pons and the medulla oblongata, you have got this line over here. You see, this line here is called as pontomedullary junction. Between the pons and medulla oblongata, you have got pontomedullary junction. So from this pontomedullary junction also, you have got three cranial nerves that are coming. So all of you look, see, this is one cranial nerve that is 6th, this is another cranial nerve that is 7th, and this is another cranial nerve that is 8th. Okay, so 6th cranial nerve, 7th cranial nerve, and 8th cranial nerve. What is your 6th cranial nerve called as? 6th cranial nerve is called as abducent nerve. Abducent nerve. 7th cranial nerve is called as facial nerve. Facial nerve. And finally, 8th pair of cranial nerve, you call it as what? You call it as vestibulocochlear nerve. Vestibulocochlear nerve. Okay, so you've got three pairs of cranial nerves, that is the 6th, 7th as well as the 8th pair of cranial nerve. So these are the three cranial nerves. Now, important thing you need to know here is that as I've already told you, oculomotor is from the midbrain, the fifth sensory and motor is from the pons, and these three, vestibulocochlear, facial and abducens, are coming from here. Now, there is one very important clinical condition by name schwannoma, vestibular schwannoma. So what do you mean by vestibular schwannoma? Vestibular schwannoma, in the sense, this is the tumor that is mainly related to the 8th pair of cranial nerve. Tumor, right? So if there is a malignancy to the 8th pair of cranial nerve, that one you call it as a vestibular schwannoma. So whenever there is vestibular schwannoma that is developed exactly here, you see, vestibular schwannomas are developed in the cerebropontine angle. So exactly when you see this vestibular schwannoma in the cerebropontine angle, what will happen? This tumor can even spread to the other parts, and even the 6th and the 7th pair of cranial nerve can also be damaged. Okay, so that is the reason why whenever you come across a patient with vestibular schwannoma, you would see features of facial nerve palsy, you would also see features of abducent nerve palsy. Apart from that, you will also see features of vestibulocochlear nerve palsy. Okay, so that is the reason why we need to do an MRI of the cerebropontinal angle to look at this vestibular schwannoma. Okay, so these are some of the important things over here. Now, the second important thing which we shall be discussing right now is your cerebropontine angle. So now, if you can see here, this is called as pontomedullary junction. Now, behind this, you have got cerebellum. From the lateral aspect, you can look at the cerebellum. So between the cerebellum and the pons, we have got an angle, and that angle is called as cerebellopontine angle. We shall look at what are the borders of the cerebellopontine angle and what are the contents of that. Okay, so this is called as cerebellopontine angle. So we shall look at what are the borders of this cerebellopontine angle. Now before that, all of you just focus here. This is your pons, and after that this is your midbrain, and after that this is your pons, and then here comes your medulla oblongata as well as spinal cord. And I have already told you that here you have got your, what is this, cerebellum. So this part over here is called as your cerebellum, right? Now here, this angle which you can see in between the pons and the medulla oblongata, right? So this angle which you can see in between the pons and medulla oblongata is called as the cerebellopontine angle. So what we'll do is that we will draw a line like this, we will draw another line like this, and we will also draw a third line in this way. Okay, so let me rub out these lines. Yeah, and another line in this way like this, and a third line like this. So this angle which you can see over here is called as cerebellopontine angle. So in this angle, let us see what are the borders here. Let us say this is the this is called as a roof of the first border, and this is called as the second, and this is called as the third. So let us say what is point number 1. This point number 1, isn't it the superior border, right? But this is a superior border of the petrous bone. Where is the petrous bone? Petrous bone is a part of your temporal bone. So you have to write it down as it is a medial. Part number 1 forms the medial 1/3 of the superior border of petrous bone. Superior border of petrous bone, right? So petrous bone is a part of what? Petrous bone is a part of temporal bone. Petrous bone is a part of temporal bone. Second important thing, if you see, if this second line, whatever I'm drawing, isn't this line crossing the upper part of the cerebellum, right? So the second important line is upper part of cerebellum. Okay, and next, if you look here, the third important line is crossing the lateral part of the anterior surface of the pons. Okay, so this is the lateral part and this is the anterior surface. So it is crossing the lateral part of the anterior surface of the pons. Lateral part of the anterior surface of the pons. So how many important things are there? There are 3 important things. So the first point is the first line angle is formed by the medial 1/3 of the superior border of petrous part of the temporal bone. Second is the upper part of the cerebellum, and the third one is your lateral part of the anterior surface of the pons. So you know what is cerebellopontine angle. Now let us discuss what are the contents of this cerebellopontine angle. So can anyone tell what can be the contents of the cerebellopontine angle? There are contents like 6th pair of cranial nerve, 7th pair of cranial nerve, and 8th pair of cranial nerve. Not only 6th, 7th, 8th, there are also labyrinthine vessels. There are also labyrinthine vessels, right? So 6th, 7th, 8th pair of cranial nerve, along with that there are also labyrinthine vessels that are coming out. So these are all some of the important things which you need to know regarding the cerebellopontine angle, guys. So thank you so much for watching my video. Goodbye.